This is a WPTV special, The Rebound South Florida, the struggles and triumphs 1 year later.
Welcome back to The Rebound South Florida, the struggles and triumphs 1 year later.
One of the first cases of COVID-19 in our area was that of a local doctor, and we went along with his journey as he fought and survived.
After spending nearly 5 months in the hospital, Dr. Vladimir LaRoche has a story of survival.
And as WPTV News Channel 5's Michelle Casada explains, it's a story that walks us through the evolution of treating COVID-19.
This month marks 1 year since Dr. Vladimir LaRoche experienced the darkest times of his life.
So until when I get out from the ventilators, I open my eyes, it was 3 months later.
He went into the hospital battling COVID-19 in early March of 2020 when the first cases in Palm Beach County were just surfacing. Dr. LaRoche's brother, Paul LaRoche, did countless Zooms with me to update me on the doctor's condition.
It certainly was at a point where there was not really a lot of clarity about what the treatment protocol was.
There were only one treatment that people was talking about. It was the Remdesivir.
But finding the right time to use the viral inhibitor was the key.
I quickly saw the trend. Once you used it when the patient was already progressed, it just didn't make a huge difference.
Infectious disease specialist Dr. Leslie Diaz said she started using Remdesivir early on, even though hospital protocols were against it.
And then new data came out that says if you use Remdesivir early enough, that's when it makes the biggest difference.
But Dr. LaRoche did not receive Remdesivir until May. In April, his brother Paul made a plea for convalescent plasma.
This is his last chance. This is his very last chance.
If you remember, at that time, testing for COVID-19 wasn't readily available, but through the power of social media, Paul was able to find someone who had recovered from COVID-19 in Miami and was eligible to donate plasma. For this Catholic family, this was divine intervention. Their prayers answered on Easter weekend.
Maybe as the second physician to use it here in the state of Florida, and we used it up front. Again, plasma, they say that if you use it early on with mild to moderate disease, you'll make the biggest difference.
Dr. LaRoche received 2 infusions of convalescent plasma from people who had recovered from COVID-19 and carried the virus antibodies. But complications from the virus on his body led him to remain intubated for 3 months. When he left the hospital in July, he had to learn how to walk again, write, speak. Now, nearing 1 year later, how the medical community treats COVID-19 has evolved.
Now we're up to the JAK1, JAK2 inhibitor, which is a pill that's used for rheumatoid arthritis. It's called baricitinib, and we use it in combination with Remdesivir. And that showed an improvement in symptom progression and an improvement in the days that they were in the hospital.
Monoclonal antibody treatment is also used now, Dr. Diaz says, in an outpatient setting.
It's an antibody that neutralizes the spike protein, so the virus cannot attach to the ACE2 receptor in the different areas of the lung and other organs.
When it comes to patients being admitted to the hospital with oxygen levels decreasing, there isn't one magic combination.
You really have to kind of throw everything at them.
Dr. Diaz says mutating strains of the virus are also a concern.
We don't have anything different in the protocols of medications to combat that. And this is the reason why it's so important for everybody to get vaccinated yesterday.
Dr. LaRoche does not know if he would have responded differently to treatment protocols now. What his brother does know is that through the dark times and this journey,
You've impacted so many people while you were in a coma.
they raised awareness and helped many sick patients receive plasma donations.
I think all these things sort of needed to happen. I mean, he needed to go through what he went through in order for us to be where we are today.
Michelle Quesada, WPTV News Channel 5.
As more cases were confirmed throughout our area, all eyes turned to local leaders. What steps would they take to help slow the spread? Some implemented mask mandates, shut down beaches, set curfews. County leaders even held weekly updates to keep everyone informed. When I spoke to Palm Beach County Mayor Dave Kerner, he praised the collaboration between local leaders and those at the state level.
I'm happy to admit that when I look back over the course of the time throughout this pandemic, really in that initial stage where there was so much fear and so much fright and so much uncertainty about the economy and the confluence with public health, and how do we properly regulate those two in terms of shutdowns and curfews and all those things that wreak havoc on businesses. I have been impressed with how the governor has handled those issues.
The mask mandate in Palm Beach County remains in effect in all public places. On the Treasure Coast, St. Lucie County also requires masks in public places, while Martin County only strongly recommends the use, but there is no mandate. In Indian River County, masks are required for workers in unincorporated parts of that county, as well as on public transportation and inside county facilities. And masks are required for county office visitors in Okeechobee County.
Palm Beach County used federal funds to send masks to all residents. Those funds were provided through the CARES Act. Each of our 5 counties used the money to assist small businesses, help residents pay rent, mortgage and utilities, and help nonprofits. Counties also used the money to make sure no one went hungry.
As South Florida shut down to curb the spread of the virus, scores of people lost their income and the ability to feed their families. Food distribution popped up almost everywhere from the Treasure Coast to Palm Beach County, and the need is still prevalent a year later.
But as WPTV News Channel 5's Ryan Hughes showed us, so many of you stepped up to help feed the hungry.
Cars backing up and popping the trunk as volunteers drop in boxes and bags of fresh produce and food.
Thank you. No, thank you.
On this day, the line is steady inside the Indian Pines community in Lake Worth Beach.
Our demographics are, all people in all ages now are very, very food insecure.
Over the past year, the nonprofit Palm Beach Harvest hosting drive-through food distributions in nearly every corner of Palm Beach County. The coronavirus crisis causing food insecurity to surge.
With the closing of many restaurants and people losing their jobs, people that were living paycheck to paycheck are now not even getting a paycheck.
According to the United Way of Palm Beach County, more than 300,000 people in the county are now food insecure. That number hovering around 180,000 before COVID.
No one should go hungry. And no one should go hungry.
But the pandemic forging new partnerships. The Community Faith Outreach Ministries teaming up with Palm Beach Harvest.
And we can't do it alone, but if we pull our resources together, certainly we can do something to better our community.
We have onions.
And the National Council of Jewish Women also joining the fight, launching Soup for the Soul. Volunteers helping fill hundreds of bags to help feed families.
This will go every month. Two communities will be doing this drive.
Palm Beach Harvest says before COVID it distributed about 5.5 million pounds of food a year. But last year, between April 1st and December 31st, it distributed nearly 8 million pounds.
And now it's getting worse rather than better because now these people have been out of work, people are not able to go back to work, and the food insecurity is at its peak now.
The need to feed ramping up and showing no signs of slowing down. In Palm Beach County, Ryan Hughes, WPTV, News Channel 5.
It was a bright spot in all the darkness.
A year of our lives were taken away from us.
One family's journey from heartbreak to hope.
Plus, balancing work life and home life in the same place. The challenges and successes people have found while working from home.